Um, Thank you, Jo.
Hi. Hi, everybody. Thank you for inviting me here today. It's a privilege to be here with you. So my name's Julie Roy. I'm the head of nursing for primary care at East London Foundation Trust. And it is very strange having primary care within a trust, but it is. And it is going well. There is a lot of work there. I would definitely say my journey from the Rosalind Franklin, when I first kind of decided that I was going to go ahead and do it, I'm in an RN with this program. Um, for me, the Rosalind Franklin program changed my life. It was, and I think for some people, maybe you need to be at a particular place in your life and for something to be that powerful. But for me, I think that I was at that place. Um, and I applied at the time. Karen Story was the lead nurse for primary care for NHS England at that time, and I was quite apprehensive of what was going to kind of happen. You can go to the next slide. So I was quite apprehensive of what was going to happen on this particular program. So it was for mid-level leaders aspiring to lead large and complex programs, department services, or systems. At that point, I was working at an it wasn't ICB at the time, it was the CCG. And I was the nurse consultant there. And I just felt like I needed that kind of guidance on what I should do, how I can kind of go forward a bit more as a leader. And as you can see, there's 120 hours online and that there was 4 workshop days. R1, we had there were 3 days that you had to attend at the very beginning. You had to attend 3 consecutive days at the beginning. And then we had 4 workshops that were split up over the 9 months. And then we came together again for another 2 workshop days. So as the speaker before me has said, it has changed. Thank you. It has changed from what it used to be to what it is now. Um, but for me as a leader, it was it was, I would even go on to say it was a little bit spiritual for me. So I went to my first day and I remember attending, and I think that the facilitators were seeing who was in the group, and we had some really difficult things that we needed to challenge. And I sat there and I was looking at the group because it goes out to national, everybody, all nurses, clinical clinicians in England can attend. And for me, one of the first things that I saw was, hold on a minute, this has gone right throughout England, and it was literally, there was just 2, I have to be honest, there was just 2 Black people that were there. I thought, what's going on here? And I thought, okay, let's just continue. Let's see how it goes. And I made so many friends, even up to now. And I did my training. This was in 2019. Even up to now, I'm very, very good friends with most of my cohort that I've got them on my phone. But I looked and I thought to myself, okay, this is going to be the first challenge. Let me see what's going to happen here. And one of the things that they kept on bringing up onto the presentation was looking at diversity. Now, back then in 2019, I have to remind you guys, we weren't talking about it as much as we talk about it now. But this was something that they were saying a lot on this slide. And I sat there and I said, what is it that you want us to say? Because the 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 participants aren't saying what you want to hear from them, and I think I know what you want, but what is it that you want? And they said, we want you to actually say what you've seen. So I said, look, clearly there is already, it's difficult for us looking at people from diverse backgrounds, and how to kind of interact and how to speak about those people that we're seeing on the screen. If that's the case, then it's going to also affect us within our normal working environment. Now, guys, I was a very shy person. I'm the sort of person that historically, even up to now, put me in the nice little office, just me. I'll see everybody in the coffee room, but I kind of quietly like to hide. But I found my voice. I found my voice. And I started to speak up within the sessions. And they would often say to me, Julie, what do you think about this particular point? To the point that I said, oh my God, I'm showing the real Julie, the one that I've been trying to hide. And I remember saying, this is one of the statements that I said to all of the colleagues that was there. I said, I can see that you have a problem with looking at black and white people and actually referring to black people or to brown people or people of color, and that seems to be an issue. And I said, I used to work at a place, Sexual Health, and we used to have patients that came in and we had to ask some really intimate questions, to the point that at first I was embarrassed. Then afterwards I wasn't embarrassed. So what I want you to say right now, black, white, and a lot of them now, when they see me, they say, oh, Julie, you spoke to us about black, white, because I want you to break down this stereotype. And from there, that was, as I said, was where I started to find my voice. On the sessions that that first bit, how we did it, the first 3 days really helped us to build up a bond with each other. We built a friendship with each other. If you wasn't there for one of the days, they would say, where are you? We missed you. And I remember saying to myself, how can you miss me for one day and you don't even know me? That was how powerful and how the bond that we had within that particular group was for me just really striking. But when we came to our sessions that we had, the 4 workshop days, they broke us down into smaller groups. So, and in your group, as I said, I had people all over the place, from Liverpool, Manchester, Leeds, Yorkshire. You would have somebody from that was from, say, Cornwall. And what we would do was take it in turns in where we would go and meet, because we realized that we were living in such diverse areas. They did try to bring everybody, those people in that area, but we did say, okay, we will take the challenge and be willing for you to put us as you want to put us, just so that we came out of our comfort zone of me just staying with the London crew, if you like. I thought, I'm not going to stay with the London lot. I'm going to go with the Northern lasses, because do you know what? These guys, they're different. You guys know up north, they are very, very different. They're very, very friendly. And I like that. So I met with my team, and we would discuss points of leadership, because we had a lot of these videos, the online bit that they're talking about. And I will say to you, you can't kind of skip over it. You really need to do the online work. So at first you may feel, oh, I don't want to do the online work. But every time I sat down and I did the online work, I left there feeling, my God, this was really powerful. There was one that they spoke about, Professor West, and I always quote him now in a lot of the things that I do, when he was talking about teams and how teams work. And so slowly but surely, what you started to find was this online work was starting to sink into your mind. We had to then document. So you couldn't get away with it and say, well, I've done my videos and that's that. You had to comment on everything that you were watching, how it made you feel. You kept your diary, as well as commenting on a site that, you know, we could discuss the actual program that they had given us for that session, and then it would close it down, so nobody would be able to get away. Basically, you would all have to add to this, and it was, as I said, really, really good. Looking at it at the time, I did feel like, oh my God, do I need to do another one of these online trainings? But every single one, in all honesty, they were beneficial and has helped within my leadership. If you go to the last slide there.
Just interrupting, sorry, just so you got about 1 minute.
That's fine.
That's okay.
That's
all right,
fine.
thanks.
As you can see within the Rosalind Franklin program, they've got the leadership, you've got change management, how teams work, system leadership, understanding where you are, your services located in the wider health and care system. You can see it's there on the screen. That they are the areas that you start to focus on. And the more you start to look into those areas, the more you start to look at how you lead, you start to look at leaders that are around you. Part of it also was we did something called a 360, where we had to have our colleagues do a 360 on us. Now, if you're in primary care, most of the time I find that it's the GPs who are training who have that 360, that, you know, when we write up about them and they say, can you write a comment about me? It's like a 360 like that. That's what we did. And all of us had a 360 to look at our leadership styles, how we lead, how people perceive us. So it's very, very powerful, the course. I would absolutely encourage anybody to go onto it. I think it has totally changed my life. I've moved from working as a nurse consultant at the CCG. I'm now the head of nursing at a trust where we don't normally have primary care in the trust. So therefore you can see how much that's kind of just led me, and I lead a full team. So that's me for now. I'm going to hand back over to Sandra